Okay, folks, this chat is going to start out with defining some terms, and then I'm going to move into talking about the big picture of what SLPs look for in swallowing. And finally, I'll discuss a little reflective task that I'm going to ask you to engage in. So let's get some terminology down. The technical or medical term for swallowing is known as deglutition, and its most simple definition is just the processing of food from the mouth to the stomach. Now, in order to get food from the mouth to the stomach, there are a lot of complex activities that have to happen. There are going to be 4 phases that we're going to talk about. And those phases move from voluntary phases, which are under our volitional control, meaning we can manipulate the system. As the food begins to pass further down into the system, that process becomes an involuntary process geared by neuromuscular kinds of activities. A more technical definition of deglutition involves the passage of what we call a bolus. Now, if the bolus is liquid, it doesn't really require anything because as soon as liquid gets in our mouth, it is a bolus. It's a well-formed, if we can hold it in our mouth in a well-formed manner and then pass it on. But for solid consistencies, we have to prepare the solid food. So we have to break it down using saliva and chewing it and prepare it into pretty much what would be the equivalent of a comprehensive ball substance. And that ball substance is known as a bolus. So deglutition is the passage of that bolus from your oral cavity to your stomach by way of your throat, which is known as your pharynx, and your esophagus, which is known as your stomach tube. And importantly for the speech language pathologist and for the patient, of course, is that deglutition bypasses the entryway into your larynx. And so if you go back to your notes from SLP 320, your anatomy and physiology class, you should be well aware of the structures in the larynx. I'm going to review all of them here for this class, just so that we make sure that we're on the same page. But in order to safely swallow, engage in deglutition, and move food from our mouth to our stomach, we have to bypass the entryway into our airway, and that is known as the laryngeal vestibule. So we're going to come back and talk all about that anatomy. Now, feeding, on the other hand, is a term that we use in reference to infants. So when we talk about deglutition with infants, we're going to add a social component to that, and therefore it becomes more holistic. We call it feeding in that case, and rarely in the adult literature are you going to see it referred to as feeding. So when we're talking about practicing with very young children or with infants, we're going to refer to it as feeding. And just like deglutition, it involves the aspect of eating or drinking or passing a bolus from the oral cavity down into the stomach. In infants, that usually requires gathering the material and suckling or sucking, right? We already know that chewing and swallowing are clearly things that adults do too. But infants are going to have that added element of sucking when they're on a bottle or on a nipple in order to move food from the oral cavity down into the stomach. And finally, as I opened up, feeding includes communication and social events that form the basis for future interactions around food and liquids with infants. So there's a lot more around, if you think about picky eaters. While adults are picky eaters, they can manage on their own, right? You can pick the things that you want to eat and avoid things that you don't want to eat. But there's a lot of rituals that caregivers and parents engage in with young children or infants around feeding, right? A lot of play activities or social circumstances under which babies are fed. So just be thinking about that as a broader definition of things that the speech language pathologist needs to be aware of. Okay, so deglutition and the speech language pathologist. That might not feel intuitive to all of you because the name of our profession is speech language pathology, and nowhere in those words is there the term deglutition or swallowing. Now, the swallowing disorders and the evaluation of swallowing itself is sort of late in the development of our fields as healthcare practitioners. But because the anatomy for swallowing is shared with the anatomy for speech production, our national organization vied for us to become responsible for the assessment and treatment of deglutition. So, because we already have expertise in those anatomical structures, it was a natural fit for that to become under our scope of practice and within our license and credential. Now, the SLP will be responsible to assess the structures themselves and then their functions. So, we're going to spend a lot of time in this class talking about the structures themselves and then how they work to move food from the oral cavity down into the stomach. Now, our job is to assess those structures and their functions for safety. So, most of what we're reporting is in relationship to whether or not the patient is safe. And in that sense, what we mean is the airway is safe and protected from food going down the wrong way. Our job also includes determining the need for whether or not we might need instrumental examinations, something we call imaging. And maybe you're more used to things like MRIs or CAT scans or X-rays. So one of the most popular, most widely used imaging techniques for swallowing is an X-ray. We call it fluoroscopy. And the second most common imaging technique that we use is endoscopy or FEES with a tube that goes through the nose and drops down in the throat so we can visualize the larynx. So our job is to determine if there is a need to look further at the swallowing by instrumental examination using some kind of imaging techniques. Once we've gathered all of our data on the assessment of the swallowing and its functions, our job is to interpret those results, and we're going to make recommendations. Remember, once again, I'm bringing us back to the issue of safety. So we're going to make recommendations around safety precautions, and that also includes as our number one primary recommendation is the consistency that the patient can safely tolerate. So, as we're going to get there, but I'm going to give you a preface to that. Can the patient drink thin liquids, for example, like water or juice or coffee? We would look at other consistencies like a smoothie consistency or consistencies like solids, and not all solids are the same, right? So, eating a piece of steak is very different than eating a piece of watermelon, for example. So our job includes making recommendations around the consistencies of or textures of foods and liquids that patients can safely eat, as well as giving recommendations about any precautions that patients may need to maintain their safety. If a problem does present, it's the SLP's job to develop a plan of treatment and implement therapeutic exercises or therapeutic intervention for our clients. We're also going to wrap all of that up with training and education, and that's going to be anyone involved in the patient's care, including the patient themselves, any family members that are going to be present to assist, and any staff members that may need to assist the patient in their swallowing. And then finally, we're going to repeat this cycle. So we're doing constant ongoing assessment of the client to make sure that our therapeutic plans are working, and whether or not we might change the diet to advance it to a more regular or normal diet, or whether or not the patient might have, for example, a degenerative disease where we know that they're going to get worse, and we might need to downgrade that diet and make it more restrictive to keep them safe. So all of those things are part of this, what we call the scope of practice of a speech language pathologist when it comes to the management of swallowing. There are three driving questions that the SLP is always asking in relationship to any kind of management or assessment of a swallowing, a case of swallowing. The first is, can the patient safely consume liquids and solids, or whatever the food is, whatever the substance is? And as I said to you, it's a wide variety of textures, from the most difficult solids to the most difficult liquids, right? And thin liquids are the most difficult to manage. And something like steak or raw carrots, for example, would be one of the most difficult solids to manage. So our question is, can the patient consume these consistencies safely? And what we mean by that is there a risk for the breach of the airway? Is there a risk that the liquids or solids might go down into the person's lungs? And the best example of that, folks, because I'm sure that it's happened at some point in your lifetime, when you're drinking or you're laughing or you're talking while you're eating and something goes the wrong way, you start coughing, right? And every single one of us has had that, whether it's that, that you start coughing because a piece of gum went the wrong way, or that you drank and it went the wrong way. That would be considered a breach of the airway. The reason why we cough is because something went the wrong way and it went into our airway. The second question that the speech language pathologist is going to ask themselves is, can the patient effectively meet their nutritional needs? Okay, and those things are different. Safety is different than meeting nutritional needs. So, for example, my patient might be able to take just a little bit of food safely, but if they start eating more volume of food, they may be unsafe. Things might be backing up in their esophagus to the point where they cannot meet their nutritional needs. So while they might be safe on some things, they might not be able to meet their nutritional needs. So in that case, what we're looking for is the patient safe to consume enough food to sustain their life? And folks, this part of it is always in collaboration with other professionals, like the dietitian, for example. The dietitian deals with calories and sustenance of life around proteins, carbohydrates, and fats. But our job is to talk about the safety in relationship to being able to meet those nutritional needs. Okay. And then the third component that we're driving our questions around is the patient swallow impacting their quality of life? So we're always looking at whether or not this problem is inhibiting people's ability to engage in a normal life, right? And that means any kind of psychosocial or emotional impact of their swallowing and any problems that they're experiencing with their swallowing. So those are the three questions that are constantly driving our practice: is, will the patient be able to safely consume food? And if they are, or if they're not, like if they're able to safely consume, can they do it enough to meet their nutritional needs? And how will any of these problems that they're experiencing impact their quality of life? So what does the speech language pathologist look at in the swallow? There are two main things that we're going to talk about as we go along. The first is the anatomy and physiology. So we're going to be looking at the structures themselves and how they function. And overall, what we're looking for is like strength and range of motion. Do the structures have enough strength, and are they able to move sufficiently to get the material out of the oral cavity, through the throat, through the stomach tube, and down into the stomach? So we're going to be looking at the movement of the structures themselves. And then we're going to be looking at the coordination and timing of all of that. So timing is going to be a big piece. The strength of the structures, and then the timing of when things are moving, when the structures are moving. And speech language pathologists are going to do a lot of inferencing around sensation and pressures. Can the patient feel the material enough to trigger these things to happen? So if I don't feel something, I'm likely not going to see the anatomy responding to it. So speech language pathologists are very often inferring things about sensation, but also swallowing has a lot to do with pressure changes, right? We're trying to move a bolus through the system, and that requires pressures behind the bolus in order to force it down. So we're going to make a lot of inferences about how the patient's sensation is functioning and whether or not they have sufficient pressure. And that relates to strength of the structures and range of motion of the structures to move this bolus. So the first thing we're going to think about is the anatomy and how it's working. The second thing that the speech language pathologist is going to look at is the bolus itself. So we need to look at the substance. So we're going to look at the structures, but we're also going to look at the substance itself, the material that's moving through the system. We're looking at the control and flow of it. We're looking at the timing of it. So we might see a structure move, but not the bolus move. So if there's not enough strength, the person might be moving the structure and we can see minimal movement, but we might see very little in way of the bolus. Okay, we might see that the patient's not moving at all, but the bolus is flowing out of control. So we need to look at these two things separately. And in that bolus category, we're going to look at the control and flow of the bolus, the timing of how the bolus is flowing. We're going to look at how the patient responds to the bolus. So if the bolus goes the wrong way, let's say the material enters into the airway, what does the patient do? Is the patient coughing or are they not responding at all? Which would be very dangerous because they should cough if it goes the wrong way. We're looking at whether or not the bolus might be retained. It gets stuck in a pocket in the throat, somewhere where it doesn't belong, and it stays there. So those are the things that we're looking at in a swallow. And we're going to look at that more as we go along. Now I want you to do a little bit of reflective practice. I want you to consider one of your last memorable meals. And I want you to think about things like, where were you and who was there with you? What did you eat? Who prepared it? Were you involved in preparing it together? What did you do while you were preparing it? Did you have a little bit of wine? Did you chat? Did you pick or nosh on little small things while you were making the main meal? What do you recall of the meal itself? What items were there? What things did you like? What things didn't you like? Did you enjoy it? Were there things on the plate that you preferred more than others? Were there things that you would revisit, things that you would never want to eat again? Think about the textures of the food. Were there things that were very pleasing in the texture? Were there things that were not pleasing in the texture? And then what was going on during the meal? Were you having a conversation? Were you laughing? Was there some kind of distress over the meal? And how did any of those things impact your emotional state while you were eating? Were you joyful during this meal? Were you laughing? Were you debating? Did you have some other kind of emotion happening? What kinds of topics did you discuss? The reason why I'm saying that to you folks is that for the most part, meals are a time when we gather with other people. And meals are a time that if we didn't experience them with other people, it could very significantly impact our well-being and our quality of life. I want you to think about some of these memorable meals that you've had. How would your life be impacted if you could not participate in those experiences? Or if you were at the table and you were not able to engage or participate with the food? Let's say you were smelling it, but you were not safe to eat it. How might those things impact your life? I want you to reflect on that. And then finally, I've given you a 15-minute biography, right? So I'm going to ask you to, it's a documentary on swallowing that is the personal side of dysphagia. Dysphagia is, and we're going to talk about that, the term that we use for swallowing disorders. I want you to watch this video and take notes. Your first assignment is going to be a reflection assignment, and it's going to include reflecting on this video. So I'm going to strongly encourage you when you watch this video to take notes about the participants in the documentary. Okay, we're going to stop there.